My name is Molly Bloom, and today I'll be presenting Association and Disparities of Food Security and Child Abuse, Analysis of the National Survey of Children's Health. Child abuse is a major public health issue and is a significant risk factor for compromised development, health morbidities, and the development of mental and behavioral disorders in children. Despite the serious effects of child abuse, it's estimated that at least 1 in 7 children have experienced child abuse or neglect. Socioeconomic status plays a major part in the development of adverse childhood experiences, with families of lower socioeconomic status exhibiting a 5 times greater rate of experiencing child abuse. It's also been found that 20% of children in food insecure homes experience parental aggression, compared to only 7% in food secure households. Just as socioeconomic status has been identified to contribute greatly to child abuse, the relationship between food security and child abuse appears to be significant, and assessing the relationship between the two is critical. We also know that child abuse, as well as food security, disproportionately affects children of different demographic factors, especially different racial or ethnic groups. The evaluation of the relationship between child abuse and food insecurity and the role of differing demographic factors is therefore crucial to developing successful mitigation strategies. Our study assessed the National Survey of Children's Health using data from 2016 to 2021 to investigate this relationship. We used survey weights provided by the NSCH and determined population estimates and rates of children experiencing food insecurity and child abuse. We then constructed logistic regression models to assess their associations via odds ratio between food security groups and whether the child experienced child abuse. Finally, we constructed logistic regression models via odds ratio to assess food security and child abuse by demographic factors. While we found rates of food security to be similar across all age groups, households with lower income had higher rates of both marginal or low food security, as well as homes with Black, Indigenous, multiracial, or Hispanic children. When evaluating the relationship between food insecurity and child abuse, the odds of children with marginal or low food security were significantly more likely to experience child abuse compared to those with high food security, with marginal food security being 2.36 times more likely and low food security being 5.24 times more likely. Compared to white children with high food security, Indigenous, Black, and white children were significantly more likely to experience child abuse as household food security decreased. Our data shows us that child abuse and food security have a significant association, including overlapping contributory factors. This means that efforts to improve food security through policy, community food banks, and school-based programs may also secondarily reduce the rate of child abuse. It's important to understand the demographic factors playing a role in child abuse and food insecurity. Without correctly addressing them, the success of mitigation strategies is likely to be inadequate and may even further exacerbate the gap in accessibility of resources for underserved populations. In order to address the disparities among racial and ethnic groups, it's important that there is the development of culturally competent, evidence-based programs in order to reduce food insecurity, which may also reduce the risk factors for child abuse. Thank you for your time, and if you have any questions about my presentation, my email is listed below.